Welcome to Decoding Human Nature, the channel where we unravel the mysteries of the human mind and behavior. In today's episode, we're diving into borderline personality disorder, or BPD, a condition often described as living in an emotional storm. Imagine experiencing intense emotions that change like the weather and relationships that feel like a delicate balancing act. Before we get started, make sure to subscribe and join us on this journey into the depths of human psychology. Next time, we'll explore the psychology of manipulation. But for now, let's decode BPD. Let's start with the basics. What exactly is BPD, and why is it so misunderstood? What is BPD? BPD is a mental health condition that affects emotions, self-perception, and relationships. Here are some common traits: intense fear of abandonment, rapid emotional shifts, impulsive and self-destructive behaviors, and turbulent relationships. It's like living on a seesaw of emotions, constant ups and downs, with no clear middle ground. But why is it misunderstood? Unlike physical illnesses, mental health conditions like BPD aren't always visible. This often leads to stigma, or the belief that these individuals are simply too emotional or manipulative. Let's challenge that perspective today. Engage the audience. Have you ever felt your emotions spiral out of control? Or do you know someone who struggles with intense emotional shifts? Let us know in the comments below. Living with BPD. At its core, BPD is a combination of neurological and environmental factors. Let's look at the brain. The amygdala, the emotional processor, is hyperactive, making emotional reactions more intense. The prefrontal cortex, which regulates emotions, struggles to keep up. Now add childhood trauma into the mix. Studies show that many with BPD experience neglect, abuse, or unstable environments during childhood. This creates a deep fear of abandonment, which later manifests in relationships. But it's important to note, not everyone with BPD has a history of trauma. Genetics and brain chemistry also play a role. Understanding these complexities can foster compassion. Let's take a quick pause here to thank you for watching and being part of our community at Decoding Human Nature. If you're finding this video insightful, please consider supporting our channel. Here's how you can help. Subscribe to the channel. It's free and ensures you won't miss our next episode. Like this video, it helps us reach more viewers and spread awareness. Share this video with someone who might benefit from understanding BPD better. Your support helps us continue creating thoughtful and in-depth explorations of the human mind. Together, we can make conversations about mental health more accessible and empathetic. And don't forget to comment below. Your perspective is invaluable in growing this community. Living with BPD. Living with BPD feels like being trapped in a storm you can't escape. Here are some common scenarios. Text anxiety. A friend doesn't respond to a text. For most, it's no big deal. For someone with BPD, it could spiral into fear, overthinking, and feelings of rejection. Impulsive decisions. Imagine quitting a job impulsively after feeling unappreciated or overspending as a way to cope with emotional distress. Relationship struggles. Deep love can quickly turn to fear or anger over minor conflicts, creating a cycle of closeness and distance. These examples show how emotions drive behaviors. It's not about manipulation, it's about fear and the struggle for control. Relationships and BPD. BPD significantly impacts relationships. The intense fear of abandonment can lead to clingy behaviors, like constant texting or needing reassurance. Push and pull dynamics, where someone pulls close, then pushes away to protect themselves. This dynamic can be hard on both sides, but relationships aren't doomed. With understanding and open communication, they can improve. If you've been in a relationship affected by BPD, what challenges did you face? Share your story. It could help others. Hope and healing. There's hope for people with BPD. Here's how healing happens. Dialectical behavior therapy. DBT teaches mindfulness, emotional regulation, and distress tolerance. Medication helps with co-occurring symptoms like anxiety or depression. Support systems. Having understanding friends and family is crucial. Recovery isn't linear, but with effort and support, it's absolutely possible. The development of BPD. Understanding the origins of BPD requires looking at childhood development. Research shows that BPD often stems from a combination of genetic factors and early environmental influences. Childhood trauma. Children who experience emotional neglect, physical abuse, or abandonment are more likely to develop BPD in adulthood. Trauma can shape how individuals perceive themselves and others, creating deep-seated feelings of fear, worthlessness, and emotional instability. Invalidating environments. An invalidating environment, where a child's feelings are dismissed or ignored, can foster emotional dysregulation. This makes it difficult for individuals to understand and control their emotions, and later on leads to BPD symptoms. Genetic factors. While trauma plays a huge role, there's also evidence suggesting a genetic predisposition to developing emotional sensitivity. People with BPD tend to have heightened emotional reactions to stress, making them more vulnerable to intense emotional shifts. How BPD affects self-identity. One of the most distressing aspects of BPD is the impact it has on self-identity. People with BPD often struggle with a fragmented sense of self. Their self-image can shift rapidly from feeling confident and empowered to worthless and broken, often within a matter of hours or days. This instability can lead to unstable goals or ambitions. One day, someone with BPD might feel passionate about a career, and the next, they might question their worth or abilities in that field. Difficulty with long-term goals. Because their self-image is constantly in flux, it can be hard for them to set clear, consistent goals for their future. The emotional instability and poor self-esteem lead to an overall lack of direction in life, leaving them feeling lost, uncertain, or confused about their identity. Managing triggers and emotions. Emotional triggers are a huge challenge for those with BPD. A seemingly small event, like a perceived slight or a disagreement, can trigger an emotional outburst that feels uncontrollable. Recognizing these triggers and learning to manage them is essential in managing BPD. Identifying triggers. Common triggers include criticism, rejection, or abandonment, but these triggers can vary widely from person to person. It's vital for individuals with BPD and their loved ones to identify these triggers early to prevent emotional spirals. Mindfulness techniques. One of the most effective methods for emotional regulation is mindfulness. Through mindfulness, individuals can observe their thoughts and feelings without reacting impulsively. Practicing techniques like deep breathing or grounding exercises can help reduce emotional intensity and prevent impulsive behavior. Radical acceptance. Another key DBT skill, radical acceptance, involves accepting the present moment without judgment. This can help those with BPD cope with painful emotions rather than react destructively. Co-occurring disorders with BPD. Many individuals with BPD also experience co-occurring mental health conditions. These additional disorders can complicate the diagnosis and treatment of BPD, making it even more challenging to navigate. Depression. It's not uncommon for people with BPD to experience depression, particularly when they feel overwhelmed by their emotions or face interpersonal struggles. Anxiety. The fear of abandonment and constant emotional fluctuations can lead to anxiety, often presenting as generalized anxiety or panic attacks. Substance abuse. To cope with emotional pain, some individuals with BPD turn to alcohol or drugs. This can worsen the symptoms of BPD and complicate treatment. Eating disorders. Some individuals with BPD engage in unhealthy coping mechanisms, like eating disorders, as a way to regain some control over their lives. These co-occurring disorders need to be treated alongside BPD for the best chance of recovery. How therapy helps. When it comes to managing BPD, dialectical behavior therapy, DBT, is one of the most effective treatments available. Developed by psychologist Marsha Linehan, DBT focuses on helping individuals with BPD learn skills for managing intense emotions, improving relationships, and tolerating distress. Here's a closer look at some of the core DBT skills that can be life-changing. Mindfulness. Mindfulness teaches individuals to be present in the moment, helping them detach from overwhelming emotions. Emotional regulation. This skill helps individuals recognize, understand, and manage their emotions in a healthier way. Distress tolerance. These strategies help individuals endure emotional pain without resorting to harmful behaviors like self-harm or substance use. Interpersonal effectiveness. DBT teaches how to assert oneself in relationships while respecting others' needs, which is crucial for those with BPD who struggle with intense relationship dynamics. Beyond DBT, therapy may also include cognitive behavioral therapy, CBT, and mentalization-based therapy, MBT, which help individuals understand and manage their thoughts, emotions, and behaviors. These therapies, combined with medication and support systems, can offer a pathway to healing and stability. Support for loved ones. Supporting someone with BPD can be challenging, but it's also incredibly important. If you love someone with BPD, it's essential to approach them with empathy, patience, and understanding. Here are some strategies that can help. Set boundaries. It's important to set clear boundaries without abandoning the person. This creates a sense of security while protecting your emotional well-being. Validate emotions. People with BPD often feel invalidated by others, so acknowledging their emotions without necessarily agreeing with their perspective can make a huge difference. Stay calm. When intense emotions arise, staying calm and patient can help de-escalate a situation. Try to avoid reacting impulsively or with anger, as this can worsen the situation. Borderline personality disorder is a complex and often misunderstood condition, but with awareness, empathy, and the right treatment, healing is possible. Whether you're living with BPD or supporting someone who is, understanding the dynamics of this disorder can lead to a more compassionate and informed approach to mental health. Thank you for watching Decoding Human Nature. If this video helped you understand BPD better, don't forget to like, share, and subscribe. In the next episode, we'll explore the psychology of manipulation and how to spot it. Stay tuned and take care.